Good morning, everybody. Thank you to the 58,000 people that came forward to testing to the last 24 hours to 8 p.m. That is a great result, and I just really want to thank the community for responding to our calls for testing, because the more tests we have, the more we're able to make sure that we're not missing any chains of community transmission. Now, in the last 24 hours, New South Wales recorded 65 cases of community transmission. Now, obviously, that's a welcome drop on yesterday's numbers, but it comes with a warning in that 28 of those cases were infectious in the community whilst they were obviously out and about. So that is the critical number that we need to watch in the days ahead. We need to get that 28 number as close to zero as possible. So based on the fact that we had 28 people infectious in the community in the last 24 hours, I am predicting we will have higher case numbers tomorrow. Now, I want to send the following strong message to the community. Whilst the case numbers are bouncing around, we are seeing a stabilisation. They are not growing exponentially. That tells us that the settings we have in place are having an impact. So my strongest message to everybody is keep doing what you are doing. Keep sticking to the rules, because we are seeing the impact of that. But the next challenge for us is to see a drop in the numbers of people infectious in the community. We are seeing a level of stabilisation, but we need to see those numbers drop. So please make sure you keep sticking to the rules. Make sure you stay home and only leave the house if you absolutely have to. Regrettably, a number of people who were infectious in the community were because they went to pharmacists while they had symptoms to get medical attention. They went to GP clinics, they went to GPs. Please know that if you have symptoms, the only place you should go is to get tested and come home and isolate. If you're worried about your health condition and have symptoms, please call a health clinic, your GP or somebody on the phone. Do not present yourself to a pharmacist or a medical centre or a GP clinic if you have symptoms, because unfortunately a number of cases that were picked up were people who had the symptoms and went to get medical attention. It's so important that if you have symptoms, the only place you should be going, and again with caution and care, is to get tested and stay home and isolated. And make sure that is the case, because we don't want to see those transmissions in medical centres or medical facilities, because unfortunately a number of those cases were picked up having visited those sites. So my words of encouragement to the community are keep doing what you're doing. We're seeing the mobility data show us continually that people are moving around less, and there's a lag in that data. The data we get is about 4 or 5 days old, but what we do know is that 4 or 5 days ago there was a significant drop in mobility, and that's exactly what we want to see. What that means is do not move around unless you have to. Make sure you stay home unless you absolutely have to, and please keep sticking to the rules. We know from where the numbers are now that the settings in place are having an impact. I know that we'll get through this. We won't hesitate to make difficult decisions if we need to. But I want to say this to the community of New South Wales. We've been through these difficult times before, admittedly not with the Delta variant, which is different to what we've experienced before. But we've been through challenges before and we've come through, and I know we can do that again. So please know that our collective effort is having an impact, but we need to make sure that we do not let our guard down at all, quite the contrary. Keep limiting your mobility, keep making sure you stick to the rules, because it's having effect. And the next stage we want to see is that infectious number of people in the community go down to close to zero, which will get us out of the lockdown. 28 was too high yesterday. Even though the case numbers are lower, that 28 was too high, and I suspect tomorrow the case numbers will bounce back up. So we are in a stage now of stabilising, but we want to do better than that to get out of the lockdown. We need to do better than that to get out of the lockdown. We need to see a decline. So keep doing what you're doing. Make sure you stick to the rules. If you have symptoms and you're in doubt, call somebody before you leave the house. And please make sure that all of us work together, get the message out to make sure our friends and family and loved ones are protected. Thank you. Dr. Chant will now give her update. Minister Hazzard will say a few words and then we'll take some questions.
Thank you, Premier. So New South Wales recorded 65 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 2 new cases were acquired overseas in the 24 hours to 8 p.m. As the Premier has indicated, 28 of those individuals were infectious in the community. This is too high, and we need to see this number come down. So please stay home, don't go out. And the message that I just want to reinforce, the message the Premier has given. It's important that if you have the most minimal symptoms, you don't delay. So don't say, oh, it might just be a bit of hay fever, or it might be something, it might get better. We really want you to get tested on the first day of your symptoms. And if you have symptoms, get tested and don't go out. We are concerned that we have seen a number of people seeking healthcare at pharmacists and GPs. We're just urging you to ring ahead. And obviously, if you're sick and you need care, there should be no barrier to you getting that care. So just to reassure the community, it is fine if you need care, but we just need to bring you into your medical care in a safe way. So it's not about a barrier to you getting that care. The areas of concern, and I really need to make sure that the community is aware that the threat of COVID is everywhere. And every time you leave your house, you have to assume that the person next to you is infectious. So as you go about your getting groceries, doing those activities that you're permitted to do, it's critical that you're wearing a mask over your nose and mouth. Firmly put it on before you go entering the store, and that you do purposeful shopping to get the things that you need, and then leave as soon as possible, keeping that social distance at all times. So please, everyone has a role to play in making sure there has no opportunity for COVID to be transmitted. In terms of the areas for increased testing, Emu Plains, Cumberland, Bayside, Greenfield Park, Fairfield Heights, Smithfield, St John's Park, Canley Heights, Fairfield West, Bankstown, Condell Park, Hurstville, Roselands, Rosebery, Canterbury, Belmore, Sutherland Shire, the Georges River area, the Liverpool local government area. So those are a broad area, and they reflect where we know that there's been infectious cases in the community. There is a case in today's numbers for Emu Plains, and so who was in the community during their infectious period. The case is unlinked and under investigation, and there was also a previous case in Emu Plains the last week with no known source. So this is a concern to us. So we're asking anyone in Emu Plains to get tested, even for the most minor of symptoms. And both cases had visited the Lennox Village Shopping Centre in Emu Plains, including Woolworths. So anyone at that shopping centre itself on Saturday the 10th of July from 3:45 to 5 p.m. is a casual contact, and anyone who was in Woolworths specifically between 4 p.m. and 4:45 p.m. is a close contact. There's also an exposure that we're alerting the community to a risk at a work site at Belfrog Street in Greenacre. It's Hanson Concrete. There have been 4 cases associated with this workplace, which is located next door to D&M Asphalt, which has 9 cases associated with it. So anyone who was on the site from the 1st of July to the 13th of July is considered a close contact, must get tested and isolate since the last date of attendance. The 4 cases all worked at the site across these dates, and we are concerned that we need people to respond to this urgent request. Obviously, we're following up with the cooperation of those workplaces, but we also are alerting the community. In terms of the number of people in ICU, again, my message is this reinforces that COVID is a serious condition. We currently have 73 people admitted to hospital, 19 people in intensive care, 5 of who are ventilated. So of the 19 people in the intensive care unit, 1 is in their 20s, 1 is in their 30s, 2 are in their 40s, 5 are in their 50s, 6 are in their 60s, 3 are in their 70s, and 1 is in their 80s. So my key message is we have to work together to decrease our exposures to others. So stay at home. Do not go out unless it is absolutely required. As you're aware, we have restrictions that only 1 person from a household can go out per day to meet those essential needs. And also, if you've got the most minimal of symptoms, make sure that you're not the person that's doing the shopping or going to the chemist. It's important that you immediately isolate, get tested. Thank you. And we're also asking in those circumstances if other members of the household are symptomatic to get tested as well. Thank you.
Thanks very much, Dr. Chan. Look, I just want to emphasise that this virus is it's only mobile, it's only moving around if people are moving around. That's why we have asked for people to stay at home. In fact, the health orders direct us all to stay at home and only to leave in particular circumstances. So I stress that if we can stay in our homes and not move around, the virus won't move around, it won't be transmitted to others in the community. I also want to just emphasise to the community that one of the reasons, obviously, you can leave home is if you are unable to work from home. So if you have to go to a workplace to do your work, well, that is an allowed exemption. But I certainly want you to be talking to your employer, because if you work with your employer, it may be that there can be other arrangements in place. These days, most employers would have capacity in an office environment anyway to be able to facilitate you working at home. I stress that if you can have that discussion with your employer, that would be very helpful, because we all have this role. We all have a duty. Your employer has a duty, you have a duty to try and stop this virus moving around and being mobile amongst us. I also want to emphasise to employers, I think there's been a little bit of perhaps confusion with the employers. I've heard that some employers are telling employees they must come into the office, they think they really need them there. Well, I'm just going to emphasise to the employers throughout New South Wales, we're all in this together. Please understand there actually is a health order requiring you to allow your workers to work from home unless they really can't. But it's not really the order, is it, in the end? It's what we can all do. So I just ask the employers to think about that one, and to just make sure that you are talking to your employees about arranging for them to stay at home and to work at home, if at all possible. As the Premier said, and as Dr. Chan has said, everybody's doing a really good job in New South Wales at the moment. We've seen obviously the numbers, the broader numbers come down, but there's still levels of concern about particular people going out, particularly going to pharmacies and other places. You've got to stay home. If you have any symptoms, you've got to stay at home. If we can just get everybody to stay at home as much as is humanly possible, irrespective of the orders, to stay at home unless you really need to go to work, that would be helpful. But employers, definitely take that on board, please, and work with your staff to allow them to stay at home. Facilitate them staying at home, if at all possible. Thank you. Have we finished? Okay. Sorry, yes.
How does a retail worker work from home? The vast majority of
Sorry,
retail...
James, I just can't hear you.
How does a retail worker work from home? Yeah. And the Treasurer has said today that he thinks the vast majority of retail stores should be closed. Is that your view? And if so, will you put it in your health orders?
Look, the evidence that we've got at the moment indicates that we just need people to stop moving around, and they're doing that. They're doing it very well. They're listening to the requirements, and certainly from my point of view, that's as far as we need to go at the present time. But look, Andrew, hello.
How are you, Mr. Asma?
Oh, it's good to see you here. Can I just say that people are showing through the data that they are actually listening and they're doing it. So I think that we need to just allow those orders time to stabilise and to let people to respond. But I think our community is doing a fantastic job. They generally know that they shouldn't be leaving their home because that facilitates the virus moving around. And I just emphasise again that if you have any symptoms at all, don't go to your pharmacy. I know there are some GP practices that have exercised extreme caution and are telling people not to come. And so the community members are heading off to the pharmacy. That's not what you should be doing. You should be staying home and getting tested before you go out, obviously.
Premier, you've locked us down.
Just regarding Liverpool Hospital, before we hear from the Premier, how long is elective surgery going to be down for? And just in regards to staffing, do you have to move staff from other hospitals to fill in?
Look, these are sort of normal arrangements. We had all those occurring as soon as we had COVID outbreaks back last year. The staff are really good. They understand what needs to be done. It's a very localised decision, Clinton, from the health management. I did actually speak last night just to the senior management there to make sure that it was all working well, and they were quite satisfied that they were handling it in the way they'd handled all the other situations. So they will do the deep clean, and they'll have the staff off in self-isolation for the 14 days. It is, I have to say though, it is putting a lot of pressure on our health system, because and I want to thank the doctors and nurses, all of the staff, the cleaning staff. I've worked extensively with the Health Services Union over the course of this challenging time. And it's been emphasised that everybody in the hospital system, everybody in the health system is under pressure. Our cleaners are there putting themselves on the front line day after day, keeping our health facilities clean. Thank you so much to all of the health staff. But Clinton, I can guarantee you that yes, there is pressure, but they will get through that as quickly as they can, and we'll go back to where we are.
Premier, you've locked us down for 3 weeks. You're now locking us down for another 2 weeks. We're all homeschooling. We're all locked down. What's to say it's not going to be another 2 weeks on top of that? And you keep saying the settings are right. 33, 24, 28, infectious in the community, stays the same, stays the same. When are you going to acknowledge it's time to lock it down harder to get rid of this thing?
The people of New South Wales know that our government has access to the best health experts in our nation. And please know that we are never afraid to take those difficult decisions required to keep our community safe, and that is our absolute priority. Well, you asked a very important question. I'd appreciate you allowing me to finish my answer. And that is that we rely on the best health advice available, and the people of New South Wales know, given our track record, that we are never afraid to take those difficult decisions to keep our community safe. And the best health advice we have, and I'll allow Dr. Chant to expand on that, is we need everybody to stay the course. The rules we have in place are there for a reason. We're highlighting out every day when we see particular trends in the community, and the community is responding, and I'm deeply, deeply grateful for that.
It's not shifting. The numbers aren't shifting.
And what is interesting to note about Delta variant is different to anything we've seen, and we know that had we let this virus rip, the case numbers and those infectious in the community would have increased what we call exponentially, doubling, tripling day after day. We're not seeing that trend. What we are seeing at the moment is the start of a stabilisation period. Now, the case numbers themselves will keep bouncing around, and I want to be very clear about that. I'm anticipating tomorrow's case numbers will be higher, perhaps much higher than what we've seen today, because there were 28 people infectious in the community in the last 24 hours. But I want to send a strong message to the people of our state. Please stick to the rules. Please stay the course. If we need to adjust those settings, we'll rely on the best health advice to do that.
With respect, the best health advice has just got us a 5-week lockdown. That's what the best health advice has got us, hasn't it?
Well, what I want to stress to the people of New South Wales is, had we not, and I think I mentioned this the day we went into lockdown and the next few days, had we not taken the action we did, we wouldn't be talking about 65 or 100 or 120 cases. We'd be talking thousands. And that is the difference. We took the action we did when we did to avert medical and health disaster. And we stick by our decisions because they're based on the best health advice. But I also say to the people of our state, and the citizens understand this, if we ever needed to change the settings or do more, or take difficult decisions, we would. And I will also ask Dr. Chant to further add, given we do rely on her
but
health
just one
advice.
final thing. Can you guarantee us that we won't be locked down and homeschooling for the entire month of August, the way things are going at the moment, or the first 2 weeks of August? Can you guarantee us this will end on July 30?
We've always relied on the best health advice, and we've also said that advice gives us the settings, but part of the result, and a huge part of the result, depends on all of our actions. People are responding, people are staying home, people are far less mobile, and we're deeply grateful for that. We're starting to see the results of that come through. And that's why we say at the end of the 2 weeks, we hope to be in a much stronger position than what we are now.
But will we be opening up or not? Or will we be locking down more, in your personal opinion, from everything you know, all the advice that you have?
It's very dangerous to ask about my personal opinion. It's never about our personal opinion. It should always be based...
What health advice are you getting about the likelihood of opening up on July 30?
The same health advice we provided yesterday and the day before, and I will ask Dr Chant.
Do you expect to be opening up on July 30?
I will ask Dr Chant to... I wish I had a crystal ball. I wish I knew where we'd be in 2 weeks' time, but I do know, and I want to stress this message, I do know that a large component of where we'll be in the next 2 weeks depends on all of us.
What if you lock it down harder? What if you do tougher public health orders? What if you say 1 hour of exercise a day and shut retail? Are you saying that would have no difference in terms of when we come out of this?
We always base our decisions on the best health advice and on the best information available. We have yet to see, and I'll ask Dr Chant to confirm this when I ask her to say a few words, but I haven't had presented to me a single example of transmission during outdoor exercise. I haven't had a single example of that level of transmission. What we base our settings... What we base our settings on is the best health advice. And in relation to your recent interjection there, I've already said this morning, pharmacists, health clinics are the biggest source at the moment of people spreading the virus. So if you have symptoms or feeling sick, please, if you're worried, call somebody, or otherwise get tested, stay home and isolate, and get the best medical and health advice. That is a strong message.
Shutting retail make no difference.
You've had a go. Dr. Chan, I wanted to ask this. There's some really important information. There's reports of a case at Chris O'Brien Lifehouse. Are you aware of that? And secondly, how many people in hospital at the moment are vaccinated?
So in terms of the case at the Chris O'Brien Lifehouse, that's still under investigation. Just to let you know that there's some follow-up testing on that, just to clarify. Sometimes we have tests that are not conclusive, and that work's being done urgently. We understand some precautionary actions have been taken ahead of getting that outcome resolved. So as I understand, that person was picked up as part of surveillance testing or didn't have any symptoms. But obviously we're working through that issue, and we'll update the community as soon as possible.
So that was worker at Chris O'Brien Lifehouse?
It is a worker at Chris O'Brien Lifehouse, and what we're working through, like in all situations, is I think I've discussed with you, sometimes there can be just incongruent results, and we just need to work through what it means. We obviously act with the abundance of caution. We do not want to leave any stone unturned when it comes to the Delta variant.
So we're seeing increasing numbers of healthcare workers in hospital settings or Chris O'Brien Lifehouse who are infectious. Is there anything that can be done differently to stop this happening?
Look, it's pleasing to see the fact that we have upgraded the PPE requirements in a number of settings, and we continually review those settings, and if we've got to extend those settings, that will be contemplated. Also, it's important that we know that a lot of the people have acquired their infection not within healthcare settings but as members of the community. So that, again, that highlights the fact that your exposures both accrue in a workplace setting but also in the community. So if anyone in your household is symptomatic, please urge them to get testing. Be very cautious about attending work if you're in a house place where there's any symptoms in that household.
You gave an age breakdown for the people in ICU. Are you able to provide, is there anyone under the age group of 20s in hospital with COVID, or are you aware of any positive case under that 20s age group?
I do believe that we have had younger people, younger children in hospital throughout this period. I'll have to just check that. And just to let you know, we do produce an epidemiological report which actually gives you an age breakdown of all of the cases, and that is published weekly. So we also just need to focus on the key issue at the moment, which is really understanding the drivers for the infectious cases and what we can possibly do to work with the community to reduce that rate of infectious cases. Now, can I just say, whilst we are seeing some stabilisation, I want to see that turn around. And so everyone, including business and the community and individuals, need to heed the messages. We need less interactions. So every time you go out, you need to consider, do you really need to leave your home? Are you putting anyone else at risk by your actions if you've got any symptoms, however mild? We all need to do better if we're going to see this. The Delta challenge cannot be underestimated. And so I clearly am asking and urging the community as well as business to play their part in us seeing a decline in case numbers.
We see all these exposure sites at various retail outlets, chemists and like, but how many people are actually contracting the virus in those settings, or is it just people contracting the virus in the home?
In some cases, it's very hard to tell. There's usually investigations. So, for instance, at the moment, we are investigating a number of workplace clusters, and I indicated those sites that we were. And in retail, we've noticed that there's been often transmission to workers, colleagues. So if a worker introduces it into a workplace, you get transmission to other workers, and in some cases, transmission to patrons. So this again highlights the fact that when you're even out and about, and the sorts of settings like supermarkets, banks, those sort of services, it's pleasing when you go through the exposure list that we are seeing that those exposures are in those supermarkets and other things. So people are going, that's why we're highlighting pharmacies, medical centres, supermarkets. And for people to think that they could be exposed to COVID no matter where they're going, and assume everyone near you is probably got COVID. So that means that you need to socially distance, wear your mask correctly. We don't need complacency anywhere because we do not want spot fires to be triggered in other geographical centres.
Very clearly defined what is an essential worker in Victoria. That was done. Why can't you do the same?
As Dr Chan and Minister Hazzard have said, can I please stress the following? Everybody should be staying home. If you cannot work from home and you need to leave your home for work, there are very strict rules in place, and I want to really stress that. But we also ask for cooperation from employers, from employees, and make sure not only that you're following the letter of the health orders, but also that if you must work, you're exhibiting those strict COVID-safe plans, and that is critical. And we know that we need to make sure not only that people understand that all of us have to be less mobile. And as Dr Chan and my
strict rules in place. The rules are, if you can't work from home, you can go to work still. They're still the rules.
Exactly, and we stick by those rules.
That's not your message. It's very different to the rules of your message.
No. You must stay at home and work from home. However, if you cannot do that, you are able to leave home for work. And in those circumstances,
why
you
not
have to
tighten that, though? The Victoria did it very successfully. And you're saying we
No,
can't
they
do
didn't.
It.
Can I say the following? It's really important that if you can work from home, both the employer and the employee need to respect that. It's in the health orders. The health orders. Can I just finish? The health orders are very clear. And in relation to retail, can I say the following? If both anecdotally and evidence-based, the vast majority of retail shops aren't open, they're closed. But there are those shops that are still open which all of us rely on, pharmacists, supermarkets. Well, there may be legitimate issues for why those are essential.
If you want these retail shops to close,
a lot of employers to allow staff to stay at home in order to halt mobility. Why won't you set an example by ceasing work on some of your own infrastructure projects, WestConnex, light rail? This is all in the name of halting mobility around this city.
Can I say the following in relation to that? And that is that we know that those organisations that are continuing work are doing so in a COVID-safe way. But what is really important is to make sure that when we highlight work sites where there is evidence of transmission, that people sit up and notice. Employers and employees have responsibilities. Every citizen in this state has a responsibility. Every time we leave the house, we have to ask ourselves, it doesn't matter whether you're leaving the house for work, for interaction, for buying milk and bread. Every time you set foot outside your house, you need to ask yourself, do I need to be doing this? And you have to plan your journey, make sure you have as little interaction with anybody as possible, and make sure you follow the health rules at all times.
Premier, you said, Premier, a retail worker...
That this makes employees really powerless. If their employer says you need to come to work and they say, no, I don't want to, the Premier's saying not to, they're going to get the sack or, you know...
In a pandemic, whenever you put rules in place, we not only expect people to stick to the rules, but to respect the intent of the rules as well. And this has stood us in good stead. We need to make sure this is cooperation by citizens, individuals, families, bosses, employees. All of us have a role to play.
The Premier, workers and employees say they don't understand the rules. Workers and employees say they don't understand the rules. They need something firmer to understand what they can do and what they can't do.
Well, that is why we have Service New South Wales. If anybody needs clarification on the orders, if anybody needs information on how it applies to them, please contact Service New South Wales and we will provide you with that information. But can I stress the following? It doesn't matter what your circumstances are. Every time you set foot outside the house, you have to, or your unit, or wherever you live, you need to assume you have the virus and anybody you're coming into contact with has the virus. All of us need to stay the course, keep reducing our mobility no matter where we live. And can I in particular thank the community of southwestern Sydney who have responded in an overwhelming way and reduced their mobility. The data's starting to come through. We're so deeply grateful for that. We're deeply grateful for the high testing numbers. But there is no perfection in a pandemic. What we do know is there is some stabilisation, but as Dr. Chant has told us repeatedly, there is still the risk of this thing taking off if we don't stay the course. That's why it's really important for us to stay the course, to follow the health advice. And if people have any questions, there's information they can have. But please know that people understand if you're an office worker or you normally can do that work from home, you must.
A tradie or a retail worker, Premier, a tradie or a retail worker listening to you yesterday would have thought, I can voluntarily decide not to go to work and I can get $600 a week if I've lost 20 hours of work a week from the federal government. That's not true. If you want these people to stay home, what are you going to do to fix it?
The reality is a lot of businesses, because of the stay-at-home orders, have chosen to close. A lot of businesses who have the option to stay open or close have chosen to close. Those employees who are at home are able to get disaster payment relief, which is very important. This is why the New South Wales Treasurer and myself put a very strong case to the federal government, and we're also picking up the tab for anybody that lives outside of the hotspot areas. So if your business has closed or else your employer has given you less hours because of the pandemic, you can get help. Similarly, the business itself, if they've had to close or reduce hours or have had a reduction in what's coming through the door, well then obviously they have available to them a number of grants. This is the whole reason why we fought for a strong economic package to allow people to make those important decisions. Many businesses that can open have chosen to close. Many employees, therefore, have had less hours inflicted on them. And that is why you can get a disaster payment. But in New South Wales, we've made it so that it's not just in those hotspots, but it's all across the state. And it's not just in those hotspots if you're a business that's suffering. It's all across the state, whether you're in hospitality or tourism or the myriad of other industries that have been impacted. I'm not pretending this is easy. I'm not pretending that there's perfection in the settings. There never will be, no matter where you draw the line. But what I do know is that the green shoots are starting to show. We've still got a way to go. But the fact that we haven't seen thousands and thousands of cases is a win for New South Wales.
You're relying on personal responsibility, though.
Premier, next week, New South Wales Parliament is going to be used as a set for a film to be shot at for 3 days. Is that essential?
Oh, that's news to me. I don't know.
Well, the information has been sent out by New South Wales Parliament today. It's been sent out today. Is that essential? Is that appropriate?
Look, I don't know about that. I'll have to check.
Well, do you think that is appropriate?
Sorry, one question at a time. I'll get to all of them. It's not really nice being shouted at, can I say? Thank you.
Can Sydney adopt a so-called ring of steel around the city where there's a stricter police presence on highways, permits with very clear definitions of why people can leave to protect regional New South Wales?
Can I say, firstly, I'll ask Deputy Commissioner Warboys to respond to that, but we are seeing the vast majority of people do the right thing. We're also seeing regional communities step up and respond if somebody who's not supposed to be in their community is in their community. But I will also ask Deputy Commissioner Warboys to comment on that. But the police, can I say, have been integral in providing advice to government in relation to compliance, and we're deeply grateful for that, and allow Deputy Commissioner Warboys to comment on that point.
Thank you, Premier. Good morning. In response to your question, North, South and Western Region have an operation in place with Traffic and Highway Patrol Command that specifically targets those entry points to country New South Wales, the regional areas, the rural areas, the remote areas. It has been very successful to date to create a very highly visible police presence. It will continue. And we've spoken before about the number of reports to police in terms of Crime Stopper reports that we investigate. Quite clearly, particularly in country New South Wales, those communities are very keen to see people comply with the public health orders. Each one of those reports to Crime Stoppers, no matter how it's made, is investigated and quite often sees people issued with breach notices or returned to Sydney.
Can someone just answer this question? How many people in hospital have got a vaccine?
I would have to, it hasn't been a focus to look at all the hospitalisation data. It will be reported in the EPI report. To be perfectly frank, our focus is better understanding what are the drivers for the current infection.
With the greatest of respect,
Okay,
we've asked this for weeks. It's not that big an ask.
I think we provided some information about intensive care and indicated that no one at that time who'd been vaccinated had been in intensive care. Okay, I will commit to getting the team to pull that together around ICU, but again, can we just say that the focus of our epidemiological staff at the moment is to make sure that we understand the drivers for the infection so that we can get on top of that. Can I just reassure the community, we don't actually need to look at our own data to know that the vaccines are in fact effective. The Delta strain is the predominant strain in the UK. We have data on thousands and thousands of people, many million population, which indicate that 2 doses of the vaccines are highly effective in stopping hospitalisation and death. So my key message to the community is, yes, we will collate the data in due course, but we don't need to rely on local data. We have large studies worldwide which confirm that the 2 doses of both the AstraZeneca vaccine and the Pfizer vaccine are highly effective in preventing hospitalisation and death. In terms of my other message, even 1 dose of the vaccines can improve your likelihood of hospitalisation and death, but my key message is 2 is best. And that is why we've also brought down our recommendations for the duration of gap between the AstraZeneca vaccines. So ATAGI has updated that advice to say that in the context of an outbreak, you consider a period of 4 to 8 weeks. Now, that is trading off long-term duration of protection against immediacy of protection. And obviously, in due course, there will be other vaccines and boosters given. But at the moment, that is our strong recommendation. If you've got, please go out and get vaccinated. And we're particularly calling on people over 60 because we still know that our rates in that age group could be improved, and that is an age group that is particularly vulnerable given the strong relationship between adverse outcomes and age. James?
The ATAGI advice changed for AstraZeneca the other day in light of the outbreak in Sydney, with ATAGI recommending that anyone should reconsider access to it. If it's an outbreak, will New South Wales start giving AstraZeneca to under 40s at the New South Wales hubs in line with the ATAGI advice?
New South Wales will look at how best we can work with our GPs in terms of improving access. As I've said, the reason why we want the ATAGI advice for younger age groups is always based particularly on a risk-benefit discussion. We feel that GPs know your client, your customers' patients best, and therefore that discussion is optimally had there. But obviously, my key message is, if you are over 60, please come forward to your AstraZeneca. And I also want to, in our work with the GPs, just to highlight they're actually working really hard to get the vaccine rollout and support that vaccine rollout. And they will prioritise patients because they are also committed to protecting their patients. So please don't get frustrated if you're a younger person and the bookings are filled, because the GPs will be prioritising those, particularly they're over 60s or those with underlying medical conditions. So I just wanted to say thank you to GPs, thank you to the pharmacists, and thank you to the chemists. We're really asking you to take those steps as well, to be alert to the risk of people coming into your premises and really try and keep your workplaces very safe at this time.
Dr. Chant, there's a case.
I've got one here and one here. Sorry.
So, Dr. Chant, the Premier says that the settings in place are the right ones, but we aren't seeing the number of people infectious in the community. Those numbers aren't going down. So can you just talk us through what is the health advice that is saying that these settings are right?
So clearly we're wanting to further decrease mobility and interactions, and we're looking, one of the great strengths is working in a whole of government way to look every day at how we can further strengthen things. So everything is always continually under review, and we, from the health perspective, we're saying to get this down quicker, you need to reduce the interactions, reduce the likelihood of people coming together, and then there's a range of strategies that government will put in place to implement that. So at the moment, however, can I just say, we also needed to have the cases are continuing to arise in southwestern Sydney predominantly. And so whilst you need those macro settings, I would just like to thank the community leaders, thank the community of southwestern Sydney for coming out in testing. And so some of the strategies are also aimed at case finding very early, and that's why we've implemented asymptomatic testing, so testing without symptoms every 3 days for anyone in the local government area of Fairfield that needs to leave because they cannot work from home. It is critical that we get ahead of the curve and find the cases as early as possible and minimise any time in infectious in the community. And our review of the cases that occurred in the last 24 hours indicated that another key message for the community is don't delay. So some of the individuals had been having symptoms for a number of days, and what we need to do is make sure that does not happen, because that's another way in which we can reduce people infectious in the community. So every day we're looking at that data, and some of the messages we're giving really highlight the fact. But I agree, we need to decrease. I'm not comfortable that we just need to hold the course. We want to see this turn around, and that's going to require macro action to decrease mobility, decrease our interactions, but also very targeted work with the community. And can I thank the local government, the community leaders, the church leaders, the schools in that communities for getting the message out and working with us to make sure that we can identify those cases and stop those chains of transmission. And another key driver still remains household transmission. And so we do need to reinforce the message. And this is for across New South Wales, but across the Sydney area, not only just Fairfield local government area. It's really a message to remember that your household is the people that usually reside there. So even though you might have extended family, that is not your household for the purposes of controlling COVID. We need you to stay in your own house and only interact with those household members that usually reside there.
Dr. Chant, there is a case in Brisbane that's emerged, a 12-year-old boy. Your counterpart says it appears he's picked it up in a Sydney quarantine hotel.
would you consider, given what we're going through at the moment, recommending to government we pause overseas arrivals for the duration of the lockdown?
Look, I'm sorry, that information has not been made available. Obviously, we'll look at any transmission in our hotels. We have a lot of good controls in our hotels, so I'm happy to investigate that, but I'm not aware and can't comment.
Should we consider a pause, though, given what the city's going through?
I think the Premier can comment on the agreement of National Cabinet that there has been a reduction. Yep, so did you want to answer that, Premier?
As you all know, National Cabinet has already made a decision to halve the number of overseas arrivals to 3,000 a week, of which 1,500 will come through Sydney Airport. That's a halving of what we normally do, and that's the decision of National Cabinet.
Minister Hazard. Oh, sorry. There you go. Question to Minister Hazard then.
Sure.
Sorry, Lucy. In the past 24 hours, I've spoken to some expectant mothers who say because of the restrictions around support persons in hospital, which includes their partners, they're now considering home births, which home births do come in some circumstances with increased risk. Considering that's because at home they can at least have their partner with them the entire time. Considering the risk that does come with that and considering the focus on postnatal depression, which was in the state's budget, will you consider an overarching exemption so pregnant women can have at least one support person with them the entire time they're in hospital?
First of all, can I just say thank you for that respectfully put question, because I think that helps us be able to respectfully respond, and I will. Look, it is a difficult issue because at the moment COVID is obviously in the community more broadly, and there were questions earlier on about how we keep our health staff safe but also keep other patients in hospitals safe. I must say, from just the human point of view, I would like to see mums who are about to give birth and post-birth have their support person there with them as long as possible. I have discussed that with the senior health officials, and the instructions they've given out are reflective of that, but also reflective of, on the ground, the local circumstances might be that the health authorities just have to make some of those really challenging decisions. I think it's fair to say, I mean, a few weeks ago, I remember we were talking about, or maybe a week and a half ago, we were talking about a couple of hundred staff actually right here at North Shore Hospital being taken offline. And then I think about the same time at Fairfield, about 100 staff being taken offline. We've also got massive numbers of staff now doing work they never did before, out running health hubs, vaccination hubs. And that was because the state government has stepped up to assist the federal government in trying to get vaccines out, because GPs weren't the first people of choice at that stage, although now the federal government has expanded that. I think it's fair to say that I think everybody in the health system innately wants people to have support in a whole variety of circumstances. But at the end of the day, it has to be a local decision and a health decision in the interests of not only keeping that mum and that dad and that baby safe. I think back to the circumstance you probably remember about 2-3 weeks ago. We had a lady who was about to give birth go to her obstetrician with her partner. I think it was in Wollongong from memory, but down south. And that fellow that came in there, actually then the support person actually, I think it was that support person anyway, gave, well, the result was, I'll be very careful what I say, but the obstetrician ended up with COVID and somebody else in the waiting room ended up with COVID. So I think it is a highly difficult and challenging circumstance in each situation. So whilst my heart goes out to those people, and I've certainly made that point, that as far as possible compassion and care and concern has to be the overriding factor, that compassion, care and concern can also mean you have to look at what risks that there are around COVID. So it's not easy. This 100-year pandemic is not easy when it comes to those issues. Sorry, Sarah, yeah.
Pfizer being available to the over 30s in WA and the over 16s in the Northern Territory. Given the heightened risk here, can we redirect more Pfizer here? And secondly, there is a suggestion that the Pfizer second jab can be spaced out more than 3 weeks to allow more young people to get their first jab.
Sarah, look, we've obviously struggled with that. We have the largest population in the country. We have a very vast geographical area, but the single biggest problem we have remains that the vaccine suppliers, Pfizer, are still in short supply compared to where we'll be in just a few weeks, I must say. What the federal government is telling us is that by the end of September they believe they will have a lot more Pfizer vaccine. And at that stage we'll certainly be reviewing all of the circumstances. But can I say to those young people, again, we wish we had more vaccine because we would certainly like to be able to distribute it more broadly. But at the present time, the health advice is we really do have to focus on the groups that we're focusing on. But my message to those young people is we are very conscious of your situation, and as soon as the federal government makes available more vaccine, we'll certainly be reviewing it. I must say, Andrew, I know in the States, I've had friends in the States who tell me that for months now, 12-year-olds are being given Pfizer. So the FDA, the equivalent, that's the regulatory body, the equivalent of our TGA here, our federal body, made that decision many months ago. So I think that the decisions around both who is appropriate but availability are the big issues. And our state government doesn't manage either one of those issues. They are in the federal domain.
Premier, do you have any regrets? Premier, do you have any regrets? Premier, do you have any regrets about the way that you have handled this crisis that the government has from start to finish, from the aircrew driver health order to how many restrictions you put in place, when you put them in place, to keeping retail open? Do you have any regrets at this moment?
I say the following, that we are far from perfect. Dealing with a pandemic, especially a different strain such as Delta, does leave us in uncharted waters. But I just want the people of New South Wales to know that every decision we take is based on the health advice. And I just want to reiterate what Dr. Chant said a few moments ago. The 28 number of infectious people in the community in the last 24 hours is too high. Unless we get that number to zero or as close to zero as possible, we cannot come out of lockdown. That's why we ask everybody to please respect the settings. The information we give you every morning is based on the information we have. In the last 24 hours, the best health advice I received from Dr. Chant and her team is that too many transmissions occurred in pharmacies, in GP clinics, where people are getting medical attention. Of course, there are other workplaces and other things that Dr. Chant mentioned as well. But please know that the information we provide the community is based on the best health advice. We need that 28 number to come down because based on that number, I know for a fact case numbers will be higher tomorrow.
And will that take tougher restrictions for that to
well,
it looks like it will.
We always take the best health advice. One thing I do know for certain is had we not gone into lockdown, there would have been thousands and thousands of cases in New South Wales today, because we know that without limiting mobility, this virus would have taken off. We are now at a place where there are still 28 people who are infectious in the community. Unless we get down to zero or close to zero, we can't get out of the lockdown, but a large part of that is up to us. Please don't move around unless you have to. Don't have interactions with others unless you have to. I know it's really hard, but if all of us work together, we will get through this in a timely way, as we've done before. New South Wales has done it before. We can do it again. But that 28 number, I just need to make this point, that 28 number is too high. It's too high. Whilst, it's been a stable number, it hasn't grown. Unless it comes down, we can't get out of lockdown. So I just urge everybody to please follow the health advice. Please have, as difficult as it is, as less social interaction as possible with anybody. And please make sure you think about what you're doing every time you step forward outside your front door.
An update on the Westmead nurse and the situation there and how concerning it is that medical staff are being affected?
I'll just ask Dr. Chan.
It's pleasing that Westmead nurse was fully vaccinated and didn't have any symptoms, so I haven't had a status update on that person's condition. But we know the vaccines are highly effective in protecting against severe disease or even infection in the case of Pfizer, but we still know they're not absolute. That person was picked up as part of surveillance testing, so again another strategy we're putting in to really understand transmission and make sure we prevent it. All of our we have got strengthened training in relation to personal protective equipment. And obviously, we put in all of those barriers to protect our healthcare staff because they are so critical and we do not want to see healthcare staff exposed.
John, the Premier said that you advise that too many transmissions are occurring in
so rather than
how many transmissions
rather than
GPs and pharmacies?
Okay. So what we're noting is two different aspects. Is we have seen some transmission in healthcare settings, and that relates to either specialist rooms or general practice. We have worked with GPs and also the specialists to get messaging out for them to be alert. So suggesting that someone, for instance, rings if you've got a booking, an essential booking, that for those services that you're rung, check you've got no symptoms and see if the consultation can happen on telemedicine. What the Premier is highlighting today is when we're looking at the settings where people are infectious, we're finding that people have potentially been out with symptoms, and what they've been is in chemists or gone to doctors. Now, obviously, we have to wait for some period of time to see how many infections arise, so we're just highlighting the fact that we want a little, we need to put in some additional measures. So our messaging, if you have got symptoms, you should go and get tested. Don't go yourself to the chemist. Get someone from perhaps a different household if you need some Panadol or paracetamol or other, a script filled. Get someone from a different household that you've had no contact with to facilitate that, or call the pharmacist and see what arrangements can be put in place. Get tested and don't go to those facilities. So we do not want anyone with symptoms going to ask advice from a chemist about could I have COVID or getting cold and flu tablets. We really want you to be getting tested and ringing ahead and getting an understanding of what you need to do. Obviously, my other message is if you need urgent care or care, ring your GP and the health system is ready to treat you and respond to you regardless of your symptoms. We do not want anyone sitting there with chest pain thinking they can't move out of the house, even if they've got some coughs and colds. So I want to reassure the community about that, but we are asking and alerting people to this issue, and this is what we've noticed over the last couple of days.
Premier, just on schools, just principals are saying they're hearing from parents that some of their employers aren't cutting them enough slack while they've got kids at home and they're managing remote learning. Do you have a bit of a message to the business community about trying to cut them some leeway?
Yeah, I think generally people have been responding well, as difficult as it is, and we all know and have examples of loved ones who are having to work from home and homeschool all at the same time, and we know what a challenge it is. But I do want to thank everybody in education, in the non-government education sector as well, the independent and Catholic systems, as well as the public education sector, who've really stepped up and supported our students and families during this difficult time. And of course, we ask employers to always be considerate. But the general feedback that we're receiving is that there is that high level of cooperation. In fact, people are responding in a more timely way than the last time we were in lockdown because they've been through it before, as difficult as it is. And we always know that our first priority is to get kids back to face-to-face learning. And so that's why that's some of the decisions we've taken around that aim. And we'll be able to say something about that beyond the July 30 date, depending on how we go in the next fortnight. There may be things we can say about some level of face-to-face learning. It's too early for that, and that's why we need that fortnight to assess what's going on and to get the best health advice as to what we can do after that period.
If lockdown does continue, Premier, if lockdown does continue for the broader population, are you saying that kids could go back to school?
Well, all we're saying is when we receive the health advice, we get that health advice based on the situation at the time. And I wish I had a crystal ball to know what the situation will be in 2 weeks' time. But what I do know,
ABC channel in WA. If you want to continue watching this, you can do so on the ABC News channel.
We will see that 28 number go down, and that is what is critical. It's too high at the moment. Too high. I know out of a population of 8 million people might think, it's only 28. But to have 28 people who are infectious in the community could mean that any of those points of contact could then start another chain of transmission, which is what we don't need. So I just urge everybody to keep reducing your mobility. Keep not leaving the house unless you have to, and please follow the health advice. And we will provide you with updates on a daily basis. Sometimes we receive multiple hourly updates from health. If we need to respond, I really want to send this important message to the community. If our government needs to respond in any different way, we will do that because we always rely on the health advice. I believe in my heart of hearts we have the best health experts on the planet here in New South Wales, and we will make sure we provide that advice to the community as soon as we have it. Thanks, everybody.
police turning away truck drivers from rest stops across New South Wales if they're coming or travelling from Sydney. Have you heard anything along those lines?
No, I haven't heard any specific examples. What I do know is that the Commander of Traffic and Highway Patrol Command is in constant contact with authorities in the freight industry. We want to see freight move in the state and across the state in the safest possible way, and we'll continue to work with industry to make sure that occurs.